AM 1060 WMEL. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. The purpose of our program, Helping Seniors, is to inform, educate, and connect seniors and those who serve seniors with resources in order to help them live an everyday life with some semblance of dignity and knowing how they can be supported as they try to age with dignity. It's all in how we do our job. There's so much going on in the world. There's so many things that are happening. There are so many things that are wrong, but there are equally a number of things that are right. And the purpose of this radio show, as it has been for 16 years, folks, 16 years, is simply to tell you about what is happening, how you can get help. We're not promoting any one special thing. We're promoting care. Care for the many wonderful services that already exist in Brevard County. But if you don't know about the services that are available, what good are they? For example, one of those services is the Veterans Aid and Attendance Program. So many people mistakenly believe that the VA goes out and tells everybody about this program. They don't. It's not their fault. It's not their job. It's the job of programs like Helping Seniors, which has a media outreach program, to simply tell you that these programs exist, let you find out how you can access them, and see if you can avail yourself of their service and help yourself help yourself. That makes a lot of sense. To me, it does. But this program is sponsored in the first part of the show by Gentiva Home Health Care, the Eye Institute, Solid Bite Dental Implants, Bill Johnson, Elder Law Attorney, radio station AM 1060, Wusthof Hospital Systems, Levin Home Care, Ebony News Today, and now Al Dia Today, which is the Spanish paper, which has asked us to print their column in their paper because they like what we say about senior programs and services that are available. The office number for Kay, who is the information specialist at the office, is 473-7770. I'll say it again, 473-7770. And Kay has access to a lot of information that can help you help yourself. Most importantly, folks, she just doesn't give you a phone number. She talks to you. She tries to find out what the immediate and surrounding problems are that you might need help with, and does her best to connect you with the resources that already exist to help you. That's our job, help connect you to resources. Today, I've got one of my longest-running panelists on the show with me today, Nancy Deardorff. Nancy is a registered nurse, and she's currently doing something different today, and so she is representing herself as a registered nurse. She is a long-term caregiver for her father. She is very intimately knowledgeable about all aspects of nursing, skilled nursing care, having been the director for a major home health care program, does skilled nursing services. That's her job. She is a nurse, and she is familiar with all aspects of dementia and Alzheimer's care. So today I asked Nancy if she would simply do a show on what I call nursing care. Welcome, Nancy.
Thank you, Joe. It's good to be back finally.
Well, it is. It's glad to have you back. Nancy also is a member of the board of directors of Helping Seniors, folks, and Nancy's been with us from the outset, and it's nice to have a board of directors that have people on the board that are very, very familiar with what an organization needs to do, what it needs to accomplish. And having said that, Nancy, I just wish you would tell our listeners, what do you think nursing care is? Just define, in general terms, nursing care for the uneducated.
Well, broadly speaking, nursing care is carried out by either a registered nurse or a licensed practical nurse, and it's carrying out the treatment orders of a physician. So we're the arms and legs that put into motion the treatment plan that the doctor orders for a patient. And there's different levels of nursing care, from very minor health issues to more critical and acute care nursing issues, and of course, different settings. So nursing care is hard to define because it's a lot of things. It's not just medication administration. It's not just wound care. It's nursing care today has a very patient-focused, patient-centered viewpoint in that in most nursing settings, even the hospital, even in acute care settings where we may be treating one specific disease process, the nurses assess the person as a whole. So we have a tendency to look at not only the physical, but the emotional, socioeconomic, emotional state of the patient, what kind of support system they have, everything, because all of those factors impact a patient's disease process and also can impact the rate of healing and recovery.
You know, one of the questions, folks, that I was going to ask Nancy right now, I'll just ask it because it's. I have a bunch of questions written down I want to cover today, but as Nancy talks, I think the best way to answer some of these questions. And one of the questions I had for Nancy was the interaction of the nurse and a doctor in care of a patient. I think you indicated in your opening comment there, Nancy, that the doctor diagnoses and prescribes treatment. The nurse is responsible for ensuring that the treatment is carried out. But more importantly, the nurse is the eyes and the ears of the doctor for that patient away from the office setting or the hospital setting. Can you talk a little bit about that, the importance of that?
Yes, that is what we are, the eyes and ears of the physician. So a physician's job is to diagnose and treat, sometimes cure. Sometimes it's more along the lines of symptom management for those disease processes that are chronic in nature, like diabetes or heart failure. And the nurse acts as the eyes and ears. So we institute that treatment, whatever it may be that the doctor wants, and we assess the patient, and we assess signs that treatment plan is working or is falling short. Now, it's not up to a nurse to diagnose or to tell a doctor this treatment is or isn't working. What we do is we report back objective data that we see, and the doctor decides, is that treatment the right one? Do I need to tweak it a little bit? For instance, if somebody is started on an antibiotic, one of the things that nurses are going to look out for acutely, particularly when they first go on that antibiotic, is signs and symptoms of allergic reaction. Signs and symptoms or signs that antibiotic is doing its job for the particular infection that's going on. So reporting back to the doctor, and then it gives the doctor a chance to say, okay, I'm on the right track, or I need to tweak this a bit, or completely change a treatment.
Where that is becoming more prevalent and more important in patient care is sort of borne out by an article I just read. Actually, I read it last night in the National Association of Elder Law Attorney Documentations. They publish a newsletter. And there has been a recent study done that shows in the home care and nursing home care situation that there is an extreme overabuse of certain types of medications that, especially antibiotics.
Yes.
That if we don't pay close attention to the exuberant use of antibiotics, we put the patient in greater harm, and we also lessen the patient's body's ability to react to certain drugs that it would be effective. Can you talk a little bit about that?
Well, overuse of antibiotics, or more importantly, inappropriate use of antibiotics. The wrong antibiotic to fight the particular bacteria or infection, for instance, basically, or a patient, oftentimes patients are very guilty of getting a prescription for an antibiotic and not completing that prescription. They start to feel better, fever breaks, signs of infection go away. They may still have 5 to 7 days left of oral antibiotic, and they say, I don't need to take it. I'm good to go. And then the next time they get an infection, they say, I don't need to go to the doctor. I'll just go in the cabinet and get those leftover 5 or 7 pills. So self-diagnosing. And what happens if you have inappropriate antibiotic treatment is we can develop what we call superbugs. And that is germs, basically, that become resistant to that antibiotic. They build up a defense against it. So that rendering that antibiotic not effective for that particular germ anymore. But that has changed over the last several years. And I can see it happening in my own nursing practice. Less and less antibiotics are being prescribed. When a patient first has a symptom of an infection, doctors are very careful now not to just quickly put that patient on an antibiotic. And usually doctors have to see several symptoms of infection before they prescribe an antibiotic. Not just the fever, not just maybe pussy drainage from a wound, but several symptoms, giving the body a chance to fight that infection first. And then, of course, prescribing the appropriate antibiotic if and when the time is right.
See, this is why I think it's so important that the subject of in-home and in-facility nursing care be more widely disseminated, and that people understand the ramifications of not doing as the doctor ordered. For instance, if you have a patient in a home setting, and if a home care provider is just simply a family member, and they think they're doing what the doctor said, and the doctor doesn't make house calls, if you don't have a skilled nurse coming in checking the patient, you don't recognize the signs of whether or not the medication is doing the job it's intended to do or not. And that's one of the things in all of my hospital stays when I came home and I had the skilled nursing care coming to the house, the nurse could assess whether or not I was on the right road to recovery or not. And I think that's becomes even more important because more people are going into assisted living care, and when they're in this assisted living care, they still, many of them require skilled nursing care.
Yes. And
if it's not administered correctly, we're just setting the stage for causing more of a problems in our medical care system. Can you talk a little bit about that? Yes.
Back to what is nursing, and then to further delve into that, what can nursing care do for a person? If you look at old TV programs or some of the senior population we're dealing with, if they look back at experiences earlier in their life with nurses were highly associated with taking your temperature or your blood pressure, giving sponge baths, giving injections,
rubbing backs too.
Rubbing backs, yes, we learned that in school.
Which you don't do anymore.
Not really, and we learned it in school. We learned if we were working the evening shift before patients turn in to go to sleep, we gave them a nice back rub to relax them. I've never really seen that happen in real life.
I know.
But that's what people chalk nursing up to. And indeed, that was a good portion of what nursing used to be. But nursing has evolved, and it's that evolution has been necessary. More and more, and this is only going to continue because of the cost of health care and people living longer, so we're seeing an aging population with more medical problems and skyrocketing costs. More and more, what the nurse has transitioned to is really a teacher. A nurse is the teacher in the healthcare field. Just like a teacher teaches your kids in school, a nurse is responsible primarily for teaching a patient or their loved ones or caregiver the disease process of what's going on with that patient, symptom management, so that the patient and family can better manage that disease process with the ultimate goal of mitigating any problems that may arise from that disease process, keeping people out of the hospital, which is good all around. It's certainly very expensive to send a patient to go to the hospital, but also anytime you have communal living, there's more chance of infection.
Right.
So nurses really are the teachers of the healthcare community. We teach patients what their disease is, what symptoms to look for, and how to manage those symptoms before for instance, a chronic disease process such as heart failure becomes so out of control that hospitalization is necessary.
Okay. You just spiked something in my mind which is not on the sheet I gave you, and it has to do with home care as opposed to facility care following an operation, say, for a hip replacement or a knee replacement. I just heard a comment from a medical source that said that medical sources, quote, certain medical sources, are saying that there's a greater chance of acquiring an infection if you go to a skilled nursing facility following hospital stay instead of going home. I realize that there are limitations with home care as opposed to facility rehabilitation. Some types are better for certain candidates than others. But to say that you stand a better chance of getting an infection if you go to a facility following hospitalization for rehab than by going home. I have some questions about that, Nancy, because some people will not do as well going home following surgery for rehab as they would in a facility where they're monitored. And I've been in a facility a couple of times for rehab following some of my surgeries, and I like to think that the places I was at were extremely careful about my care, cleanliness, and infection. Can you shed any light on that? Because this is what you do.
Yes, and I've worked skilled nursing facilities, rehabs, I've worked acute care hospitals, and I've worked in the home care sector, and each have their place. It's not a one-size-fits-all for patients. Certainly you are less likely to get an infection if you're home. In most cases. Now, I've seen cases where that may not be true, but in most cases, and it's simply because you're in your own home with your own set of germs that your body is used to, and it's not communal living. Anytime you have a crowd, whether it's a skilled nursing facility, hospital, housing for the elderly apartments, anytime there's a group of people going to the grocery store, you increase your chances of infection that are either airborne, such as cold and flu, or most of the time by touch, because people have a terrible habit of not washing their hands, touching their face, touching dirty surfaces. So it's no reflection on a hospital or a skilled nursing facility that there is a higher rate and chance of infection in those places versus home. It has nothing to do, in most cases, with the cleanliness or good infection control measures that the hospital and skilled nursing facilities employ. It's more to do with just the amount of people in a confined space. But to your point, while, my favorite sector of healthcare as a nursing professional has been home care. I know how I feel about my home, and I think there's no better, more comforting place to recuperate, recover. Most people want to be home. However, it doesn't fit everyone. If you have somebody that's recovering from an illness or surgery and is quite debilitated and doesn't have somebody at home to support them, either to help them get up and down to the bathroom or to make them participate in home exercise program or to make sure they take the correct medications at the correct time, and that can look out for adverse effects or side effects or symptoms that seem to be creeping up. If you don't have that, a skilled nursing facility may be the way to go. So it's very individual, and it depends a lot on the patient's status and the level of caregiver or family support that they have if they go home.
I think it's extremely important, Nancy, for families to realize that as you approach the decision time for leaving the hospital, that it requires all the game players to participate in what we think, what outcome we want to see acquired as safely and as quickly as possible. And I think this is where families have to be extremely honest with each other and saying, yes, I can do that. No, I can't do that.
Yes.
And I think that's extremely important. And I think that the patient themselves needs to be more involved in making the decision, because that person should know what their limitations are and what they are not.
They should, but they don't always. And there's a couple of things I want to point out that the healthcare community is getting better at. One of them is patient involvement. How interested is the patient being involved in their own care? Many times they're not, whether it's depression, lack of motivation, fear. Sometimes it's just flat-out noncompliance. If you have a patient, for instance, somebody who has orthopedic surgery for a knee replacement, there's really no reason, or very few reasons, why a patient with a knee replacement, an elderly patient with a knee replacement, has to go to a skilled nursing facility to get the correct amount and intensity of physical therapy to rehab that knee. That can be done very safely at home. However, if you have somebody that's not motivated, that when that physical therapist and that home care company gives that patient restrictions from the doctor and a home exercise program, because a physical therapist is only going to be in the house for an hour a few times a week. Right. Here's Mr. Patient, here's what you need to do in between those visits. If the patient's not going to do it, if they need a constant coaching, then an inpatient setting immediately after the surgery might be the better choice for that type of patient. The other thing we're learning more about as healthcare professionals over the last few years is healthcare literacy. I don't know if that's a term that you're familiar with.
Go ahead. What is it?
Healthcare literacy is how literate is the patient about healthcare. And it's amazing how not literate patients are in healthcare in general, and particularly their own healthcare issues. I've received some training on this, and there was an actual patient. This was a film that we watched, presentation, but it was not play acting. It was a real patient with a real healthcare clinician, and patients are often embarrassed to tell you that they can't read, and we assume everybody can, but they can't. Or the patient is embarrassed to say, I don't understand what you quite said. And in this particular film, the patient asked how their hypertension was, and then asked the patient to explain what hypertension was. And the patient thought that hypertension meant that he was uptight and anxious, hypertension, that he was hyperly tense. And she changed her verbiage to, no, I'm talking about your blood pressure. And he understood better what she meant. So it's important for those of us in healthcare to use correct terminology with our patients.
Okay. Point well made, Nancy. We're at the time for our station break. Stay with us. We'll be back in 2.5 minutes.
AM 1060 WMEL.
This is Joe Steckler, folks. We're back live with the second half of our show, focused helping seniors of Brevard County, the radio show Helping Seniors. We're talking about nursing care today. The second half of the show is being sponsored by, let me get my sheeter so I don't forget anybody, Senior Scene Magazine, Hometown News, Aldea Today, Spotlight Magazine, Seniors Helping Seniors, The Fountains of Melbourne, Beth Courtney from the Braswell Courtney team, Financial Advisors, Canadian Medications of Melbourne, Wiedemann Malik, Vitas Hospice, and Peaceful Beach Mediation, and Barbara McIntyre from Remax Reverse Mortgages. The reverse mortgages, folks, are coming to play a more important part in the ability of seniors to pay their bills at the age. But I want to tell you something. After doing a TV show with Barbara, I was thoroughly convinced that those that are contemplating using a reverse mortgage, that you go to somebody that's extremely familiar with the perils, and there are perils of doing a reverse mortgage if you don't know what you're doing, and you can make a horrible mistake. So in order to save yourself a lot of embarrassment, a lot of agony, call someone like Barbara or someone you might know, or call Kay at the office at 473-7770 and get a good recommendation on somebody to call to help you do a reverse mortgage the right way. It's foolish to make that kind of a mistake. We're back to Nancy and talking about nursing home care. One of the things, Nancy, that I'd ask you to talk about was the fact that we are now in the open enrollment period for Medicare and the types of plans that seniors have elected or selected to be their primary or backup for insurance. In the case of seniors on Social Security, it's a backup plan, but that's still 20% of the cost, and that could be very expensive. And it's more important. So one of the other things I read on the National Association for Elder Law Attorney Network was the fact that it is a proven fact that for the third time in 40 years, there will be no cost of living increase for Social Security. This has only happened 3 times in 40 years. But it is more important that we realize that the failure to get an increase in COLA is also being offset by an increased cost, an average cost of about $650 a year per senior citizen in the cost of Medicare Part B. So you really need to think, folks, about what it is that you're doing right now, because whether you want to admit to the knowledge that we have a lot of senior women that are living on $700, $800, and $900 a month and food stamps. This is a true statement, folks. This is not something I have pulled out of a hat, as somebody recently accused me of doing, pulling my numbers out of a magic rabbit hat. It's not that at all. It's true. But what is also true, Nancy, is that for all these horrible situations that we hear about, not all, but many of them can be resolved or a client helped out of a potentially damaging situation if they get to the right person for information. And here's my point here, folks. There, a Veterans Association, or Veterans, the VA, has a program called Aid and Attendance. And for these women that are serving, or living on $700, $800, $900, $1,100 a month, many of them that had husbands that served in World War II or Korea are eligible for a program called Aid and Attendance, which in most cases can bring you up to about $1,400 a month in additional income. And for a woman living on $1,100 a month to suddenly be given an additional $1,400, that must be like a gold mine, Nancy.
Oh, absolutely.
So
every little bit helps.
Yes,
when
it does.
When you're making, when you're on a fixed income that's that low.
Yeah. And so, folks, this is one of the reasons why helping seniors exists. We're not out to compete with anybody. We compete with them in a sense that we try to complete the care equation. It makes no sense to have all the good programs that we have in Brevard County to help people if you don't know about the program itself or how to access that program. For instance, there's a program called My Access. It's an access program. It's a Florida-run, state-run program. It has to do with Medicaid. And they had an office on Sarno Road. That office closed up. We learned the hard way because we started getting phone calls about the place being closed, and we found out they have a new office now opened up in Cocoa Beach. I don't remember the number off the top of my head, but if you call Kay at 473-7770, she can give you that new Medicaid access number. And yesterday we had 3 callers, Nancy, at the office that said they had tried to get to the Florida Elder Helpline, and one of them waited on the phone for 2 hours.
Wow.
2 hours.
That's
and then
a long phone wait.
It's a long phone wait. It's a long for an older person that in the first place probably didn't know how to call and get that number until she called Kay. So Kay is trying to work with these people to make these times short. And I have talked to the number 2 person in the state elder care program, and they have assured me that if I let them know about these cases, they will look into it. But that's just it adds another element in trying to resolve problems that we don't need to have to try to resolve, Nancy. We've got so many people on a Florida wait list for statewide Medicaid managed care. It's not funny. We've got we've got roughly 45,000 people on a waiting list for statewide Medicaid managed care. That's not right. But it all goes back to something else that I'd asked Nancy to talk about was many times when you look up requirements for a program, they have something called ADL. And a lot of people just don't understand what ADLs are. Perhaps you could explain to our listeners, Nancy, what ADLs are, the importance of understanding the importance of what these things mean to caregiving.
Yes, there's two terms that we use in healthcare. ADLs is one of them, and IADLs is another. And to start off with your question, ADL simply stands for Activities of Daily Living. And that's what in healthcare we call things like grooming, getting up, brushing your teeth, washing your face, bathing, showering, dressing, being able to dress yourself, put on shoes and socks, things like that, which we take for granted until we can't do them anymore, until we struggle to do them. And ADLs is important. People have to groom and bathe themselves and dress themselves. And a company advertising that they do provide for or teach ADL care is basically helping with assistance with ADLs, bathing, grooming, dressing, those kind of things. IADL is very similar. The I stands for instrumental. So instrumental activities of daily living, or IADLs, are other activities of daily living that we do on a routine basis, such as answer the telephone, being able to make a telephone call, very important, being able to prepare at least a light meal, being able to feed yourself, being able to do some light house cleaning or light laundry. Those are IADLs. And these are all things we take for granted until, it's like that old saying, you don't know what you've lost until you don't have it anymore, or you don't know what you're missing out on. And when somebody suffers from certain disease processes or conditions, it can impair their ability to take care of those activities of daily living. So many times when shopping for home care agency, whether it's skilled home care or non-skilled assistance with ADLs, that's what they mean, that they're there, they can help the patient groom or get into the shower. Some people can shower themselves, but the danger is getting in and out of the shower, and they just need some standby assistance.
Right.
So lots of home care do that, and they customize the level of help based on what the patient needs. Some patients need more help than others.
Yeah, but not all home care agencies can do what you just stated.
No.
It all depends on licensing, and that's another important thing to understand.
Oh, Kay is on the phone.
Yeah, go ahead. Yeah, Kay's calling in. Go ahead, Kay.
Yes, I wanted to make a comment, and I think Nancy, being a nurse, would appreciate this. I had a call yesterday come in where a daughter was trying to find help for her diabetic father and was going to offer free room and board in exchange for taking care of her father. After speaking with her for a moment, she said, I don't need a skilled nursing. I don't need, a nurse or anything else. I just need somebody to take care of my father, give him his shots of insulin, help him bathe, help him dress, and in exchange we'll give him free room and board. And I cautioned this lady. I said, oh, my goodness, you're really barking up the wrong tree. So, Nancy, I feel it was important to, especially since you were talking about the subject, to convey to the listening audience how important it is for people to know that they shouldn't be just looking at hiring somebody just because they want somebody to take care of their dad, but they need skilled nursing. They need somebody who's experienced in doing all that. Wouldn't you agree?
I would absolutely, Kay. And the temptation, I think, with this, I've had it happen in my own extended family. My aunt hired somebody that was not from an agency some years back. The danger is, as we all know in this country, a lot of senior citizens are taken advantage of.
Absolutely.
And when we go through the proper channels of a home health agency, sure, we want to shop price, but what you're getting for that is you're getting a staff member that's from a company that has done background checks, that is licensed by the state. The employees are bonded. So you have a level of protection. They're also screened for health as well as background, criminal background. Anybody in a home health setting going into a patient's house must have a level 2 background check, electronic fingerprinting, and that's what you're paying for, because you want to make sure that that patient, that family is protected. There's lots of people out there that will do care for room and board, but I would caution people to do that unless it's somebody that they know somebody who knows somebody, because chances are they're not technically trained, and there's much more to helping care for someone than meets the eye. Home health aides and nurses alike are taught how to move people, how to assist them with walking, how to break a fall if somebody starts to fall. I've fallen with patients. Sometimes it's inevitable. You can't stop the fall, but there's a way to help a patient fall or ease them to the ground safely. And these are all things we learn, whether it's home health aide training, certified nursing assistant training. And then you're missing the other piece, because nursing assistants are trained in a whole lot more than I think people give them credit for. How to safely move someone in bed, how to prevent skin breakdown. So I would really caution against people getting a lay person that just says, hey, for free room and board, I'll take care of you. There's no guarantees with that.
And that's my point. I couldn't stress it enough with my caller yesterday that you're really looking at the wrong angle of this. Sure, it's your father, you're trying to save money, but look at maybe the consequences that could happen, especially, and you mentioned about the falling, and she admitted, too, that her father is apt to fall a lot, and she had to have a band around him even to lift him up. So somebody that's not skilled and trained to do those kind of things, I just want to put the word out that be cautious. Be so cautious, because there's something, it's not a good trade-off, in my opinion. Go with somebody that is going to be trustworthy and has all the credentials, as you mentioned, and you'll be a lot better off.
I couldn't agree more, Kay. Yeah, it's a slippery slope, and there are very reasonable, reputable, licensed home health agencies or nurse registries out there where people can shop and get the best price. And usually, a lot of times, if you bundle certain services or if you order more than just a couple hours of care, the rate actually goes down. So I would highly recommend whoever you're talking with, if they're exploring that, to call around and shop. And most reputable home health agencies, whether it's for skilled care or just assistance with activities of daily living, non-skilled care, most of them will provide a free in-home consultation so you can meet a representative of that company.
Yeah. I want to interrupt both you, Kay, and Nancy, because there's something else, Kay, that piggybacks on what you're talking about, and that is this business of family members and family friends or people coming into a caregiving situation that you and Nancy are talking about, wherein both of these situations where people get into a house and they ingratiate themselves with a person, they get their names on a checkbook, they start diluting the people of their money, and then the person tries to get the person out of their house, and they refuse to leave.
I've seen that happen.
Yeah,
I've seen that happen. Or they're doing everything they can to ingratiate to be in the will, or take over property.
But it's more and more of this is happening. It's happened to me as when I was a director of the Alzheimer's program, and I did a TV show with Laura Moody, who is the assistant state attorney, and just yesterday, Kay had a question she called me about, and we talked about this, and we've advised the family to call Laura Moody. And Laura, Kate, perhaps you can tell the people what Laura said about a new law being passed that will help families get themselves out of the situation where just by not realizing what they were doing, people came into their homes, they can't get them to leave. That is changing, and there are vehicles for getting these people out of your house, and people are afraid because of not knowing what the repercussions might be. They're afraid to try to do anything, but they're calling us now at Helping Seniors, and this is something else that I don't know how many people get involved in this, but it's something serious. Can you address that just for a second?
Yeah, a call came in yesterday, as I mentioned, we talked about, and then the daughter and the grandson moved in with the grandmother, and simply keep saying, oh, yeah, we're still looking around, but have not done anything. So the lady has been wiped out from her checking account. The daughter has taken advantage of her credit cards and racked up extreme amounts. And again, they just sit in their rooms and watch TV all day. So the lady was calling that is a new durable power of attorney, which costs the woman quite a sum of money, too, just to even have that change. But they were like putting their hands up in the air. How can we get them out? They didn't sign a lease. They haven't paid a penny in rent. So I did speak with Laura, and she advised me to call them back and have them call their local police department, the non-emergency telephone number, and file a claim. And during that process, too, she mentioned that the new law, she didn't go into a lot of detail, but she said because there was a recently new law, it's going to make it a lot easier for them to evict these family members.
Well, the important thing is, if anybody listening is involved in a situation like this or knows somebody that's involved in a situation like that, they need to call you and get a phone number to make a call to start the process. I have a number
for you.
What's the number?
Yeah, the number that you call in the state of Florida for any suspected abuse, neglect, or exploitation, and that could be any kind of abuse, physical, mental, emotional, abuse, neglect, or in this case, what it sounds like, Kay, that you're talking about is more exploitation, is 1-800-96-ABUSE, ABUSE.
And that was the number, by the way, that the elderly woman called. She was on hold for 2 hours, and then the new durable power of attorney called yesterday and was put on hold for 30 minutes, and she gave up. So it just tells me that there's...
Kay, you and Nancy, this is what people that have this kind of thing happen to them. They need to call you because we have a way to get to the top people and the state Department of Elder Affairs in Florida to make these kinds of problems known to the people that can fix them. But if our people listening to us are talking to you on the phone, if they don't tell you about that problem and get that problem to me, then we can't identify the problem, get it to the right source to correct. The people in Tallahassee go absolutely bananas when they find out somebody's been waiting on a phone for 2 hours.
Well, and I can tell you, I've utilized that number because as a nurse, I'm an obligated reporter. Whenever we don't have to prove it as nurses, we just have to suspect that there's likely abuse, neglect, or exploitation. I've called 1-800-96-ABUSE many a time, and I usually get answered quite quickly. So it makes me wonder if something was going on personnel-wise or phone system-wise, because I can honestly tell you in my 29 years of nursing, the times that I've called, I've never had not even a 30-minute wait.
I think we might all agree, too, that, there's a lot more of it going on than there used to be years ago.
That is true.
So especially, we come down to Florida, the seniors move here, and they come into a situation where they are abused. So, we live in a state where perhaps there's a lot more going on than otherwise.
Yeah. I think another tactic for this woman that would be pretty much free for her to try is to make sure that she call her credit card company and her bank and make sure that only she is an authorized user for her account and her credit card.
That's already been done.
Yeah.
Yep. So at least in the right direction. But the main thing is I just wanted to get out to the listening audience that there are some situations where seniors are being taken advantage of, whether it be as an elder abuse and trying to get, people out of the home that really have not contributed in any way and had taken advantage of an elderly woman, or the fact that, people are looking for a caretaker and trying to save money but not looking at the whole picture where they need somebody who's really skilled and qualified.
Right. But Kay, the moral of the story is, unless seniors start sticking together and start being willing to fight what is happening to them that's wrong, we are never going to make this right. I've got an article coming out in Hometown News, A Dia Today, Spotlight, Senior Scene, and Hometown News about senior programs and a need for them and a need for all seniors to be better informed. I highly recommend that all of you get a copy of the article and read the darn thing. And if you can't get a copy of one of those papers, go to our website and pull up helpingseniors.org and look under my articles in there, and you will see this article. It makes sense, and seniors can fight this darn thing themselves. I'm tired of people saying seniors can't do something because we can.
They can, but it's scary, and we have to understand that many times the seniors that are the victims themselves are scared. And not only are they the victims of their caregivers, they are dependent on the caregivers. So there's a huge fear factor. It's like when we talk about domestic violence, why don't women leave or report things? It's very frightening for some of these seniors. So a lot of times they just accept the circumstance they're in because they don't think anything can be done.
Yep. But, folks, if you've got what you think is a potential problem area, I really ask you to call Kay at 473-7770 and tell her about it. I want to thank you, Nancy, for being here with us today. I hope that people have enjoyed the show. Remember, you can always ask us a question if you want to, but we're going to keep pumping out information so that you can help yourself, or help somebody else help themselves. But in the meantime, have a great weekend. We'll be here next week, and I'll try to get a shine counselor on so we can talk about the Medicare open enrollment period. We never got to it, but thank you, Nancy.
Thank you, Joe.
Thank you for listening, and have a great weekend, everyone. Bye-bye.